now talk to treatment czar, Yusek Leopoldo Vega. Good morning, Yusek Vega. Thank you for joining us. Sir, could you tell us how are hospitals coping with the increasing number of cases? What's the situation like on the ground right now?
Good morning to all. Good morning, Ria, and good morning to NCN and Philippines. First of all, allow me to inform you that for the last 2 weeks, we have seen a steady growth of the new cases that we have for COVID-19. And the 2-week growth rate here in Metro Manila is almost 200%. And roughly the average daily attack rate is already at 1.2%, at 1.2 per 100,000. So it only means that we are now steadily on the high-risk position, especially for Metro Manila. But for the other regions in the Philippines, still at a low risk to moderate risk. In terms of the healthcare utilization rate here in Metro Manila, hospitals have been seeing a steady increase also in the number of admissions, but the HCUR, or the rate of COVID patients admitted, is still in the low-risk position. In other words, there are still allocated beds and for COVID, which is being occupied by 30%. So roughly that's the general landscape that we have today for the HCUR.
All right. So hospitals are not overwhelmed yet, but given how things are going, when do we expect treatment facilities and hospitals and even isolation facilities to get full or overwhelmed?
Yeah, I think with the projections given by the Department of Health, we've in the with one variable, and that's the reproductive time of the Omicron virus. It would take about 5 to 6 weeks, wherein we will have a number of cases that we have. So we've been trying to ramp up already the hospital beds ever since 2 years ago. But what we would like to pursue further is to intensify our prevention, detection, and isolation for these positive patients, and definitely also the compliance of the minimum health standards, because this is the only way that we can lessen the transmission. And we hope that the assumptions of 3 to 4 weeks from now won't materialize.
Yusek, do you think at this point that it is still okay, it is safe to isolate at home, considering, if we assume that the surge is being caused by Omicron is said to be much, much more transmissible than any of the old variants?
Yes, I think isolation is a very key intervention, which means that if you're positive, if you're a close contact, if you have symptoms, it is much better if you isolate at home and if you are secured in a room and make sure that you are not going to be in contact with others. No? So I think the isolation is really a very important intervention in terms of lowering or decreasing the transmission.
Yusek, there have been recent incidents, as we have all heard, of returning Filipinos breaching quarantine protocols. How do you think we can tighten the rules for isolation of such travelers?
The only way to tighten these border controls, and especially also of quarantine, is to make it to enhance or even make sure that they follow strictly the protocols for quarantine. In other words, the hotels and everybody involved, the DILG, together with the Department of Tourism, which they have already, they're coming around, in terms of making sure that the compliance of these hotels must be there.
All right. So you're saying, sir, it's everybody's responsibility. It's the hotel, DILG, and the LGU who need to work together to ensure that all travelers really do complete the required quarantine.
Yeah, definitely, because I think an individual's contribution to the minimum public health standards will lower the risk of transmitting this virus.
All right, sir, thank you for your time. That was treatment czar Yusek Leopoldo Vega.